What if you could democratize both the knowledge to do it, but also if somebody is actually making a green building, the government could give them, say, faster approvals, right? So, in a very low cost, zero touch way. This is sort of in smart city planning, urban planning, is one of those advanced policy making that's considered very clever. That if somebody is doing it in a green way, in a sustainable way, is meeting policy objectives, what if their application instead of taking 6 months, 8 months, just fast tracks to 1 month, 2 months? Right? This is real money on the table for the builders, for the developers, because their capital is stuck in that. Now, how do you reduce that time from 6, 8 months to 1, 2 months? AI.
Hi, wherever you're joining us, I hope you're doing well. Welcome to another episode of Startup Fridays, conversations with accomplished entrepreneurs and VC investors. I'm Hari Arakli, and in this episode, Tanuj Bhojwani, head of People+ai, a non-profit effort that's working to find population-scale applications of artificial intelligence that are relevant to large problems in India, talks about some of the specific areas in which People+ai is working to develop solutions. This is part 2 of my conversation with Tanuj about how both the development and applications of AI in India will be different from what we see happening in the rich countries. People+ai is funded by Nandan Nilekani, chairman of Infosys and former chairman of UIDAI, through his EkStep Foundation. Tanuj, thanks again for making time for this. And so last time, which we're thinking will be part 1, we kind of ended with a good, simple introduction to the 4 pillars or objectives around which you're building People+ai. And today we are looking to cover that with a few more specifics, a bit more in depth. Maybe for a general audience, you could do a quick recap of those 4 objectives.
So quickly, People+ai is a not-for-profit. We're trying to build a network of doers, dreamers, tinkerers, and builders who are working in AI to make India an Adbhut India. We do this both ourselves with some initiatives, but also through a network or a team of volunteers. And anybody can sort of come in and pick an area that will help India become Adbhut by the end of the decade and volunteer to do so. Our work is primarily categorized into these 4 verticals that I was talking about. The 4 pillars of our work is, number 1, finding population scale use cases for AI in India. Number 2, finding or building the infrastructure required to take these use cases to population scale. Number 3 is we create communities, spaces where different people from different backgrounds can come in and collaborate and build something together to help each other out as we're on this journey together to get to an Adbhut India. And number 4 is cheerleading. It's essentially is our thought leadership, but also our events, our celebrations, everything we do to reinforce the message that AI is happening in India. Real AI is happening in India. It's not going to look like it's looking in the West. We're not going to throw billions of dollars on training large models. But we are doing very, very interesting, very, very life-changing work here. And it would be very useful for people to see all of that in action.
All right. Can you walk us through some of the use cases that you've already identified?
All right. So I think the biggest one there that we are really trying to get going this year is something we call Ki Baat. Ki Baat is actually a very simple idea. It's listening at scale. Now, what do I mean by that? I think if you take any organization, etc., your primary interest, whether you're a government, whether you're a not-for-profit like us, whether you're a private profit-making entity, it's everybody's interest to serve that ultimate stakeholder, which is the customer, right? For the government, it's the citizen. For us also, it's the builders, the community. The more your organization scales and wants to have an impact, and the more people's and lives it touches, the harder and harder it becomes to maintain that 1:1 connection with your customer and really understand what they need. Now, in startup folklore in the West, there is this, YC especially is famous for telling its startups that if you're trying to start up, don't get caught up in your fanciful ideas of what you're building. Go talk to your users, talk to your users, talk to your users. But what they're actually saying is go listen to your users, right? Don't just get caught up in your own ideas. You may be good, what the world should be, but don't get so carried away by that you're disconnected from your users. And this, the larger you become, the more this is a reality. Listening to your actual users is a game of Chinese whispers, right? Because you may have a user who's talking to some agent of yours, who's talking to some manager, who's talking to something. By the time the message gets to you, it's completely distorted by the incentives of the people in the middle, right? Who are also responsible for delivering something to the user. This is probably not so true in a small startup, but very, very true, say, in a large government setup, right? Where the frontline worker is in a remote village, in a district, reporting to a district officer, reporting to a block officer, who will tell a state officer, who will then consolidate data, tell to the some lower level bureaucrat in the central government, who will then take it to the senior administrators, gets to a secretary who has the power to maybe change the design of a program. So that becomes a game of Chinese whispers, right? Um, with AI, when I say listening at scale, it's not that you're able to spy on a lot of people, right? Like, that's the wrong way to think about what at scale means. What I'm trying to say here is one-to-one conversations, which are hard because you need to give attention, you need to give your own time, and you're only talking to one person at that time. With AI on the other end, AI listening to a user, you can actually scale that everybody gets a chance to air their grievances or say what they have to say to a representative of the organization. And that representative is a high fidelity agent of that company who will actually capture everything you're saying, understand it, summarize it, and if it is urgent or whatever it is, it will take it through the right channels to the right people, right? So you actually flatten all those layers, right, between that end user and the decision maker. And this is incredibly powerful. It's incredibly powerful because sure, everybody has feedback on whether service was good or bad or whatever, but let's say if there is somebody who has a feedback saying, hey, this happened to me and this could have been life threatening, that message should travel a lot further and a lot faster, right? So companies can become very, very responsive to their stakeholders if they use AI in this way. And this is interesting because in the West, again, mostly the ideas of what you can do with AI is a lot of them are around chatbots, right? Where people come in, and they talk to a bot, they write a question. It's a high fidelity question, right? Which the person has the ability to articulate what they want, give it to the bot. The bot goes and searches over a knowledge base. So the knowledge that this person needs to answer that question is already digitized, already exists, right? And then the bot is supposed to answer that question without hallucination. So this is the what's usually called retrieval augmented generation, or RAG paradigm, where it's a chatbot over a certain set of docs or knowledge base. And this works if the user is high agency, can articulate what they want, knows what questions to ask, etc., and that the knowledge is digitized and the bot doesn't hallucinate. But when you come to the JKB or Ki Baat protocol, what we call it, voice of the people, in a context like India, I think this is useful in some scenarios where RAG won't be useful, right? RAG is also useful, but where that can't be useful, this is very important because here the assumptions are flipped. Here you can have a bot initiate the conversation. So feedback call can happen at the time that one needs to have it. So right after an event has occurred, right after some service has been delivered, a feedback call initiated with the context of the transaction, right? So it's like, hey, you just bought a Starbucks coffee, right? It's probably a high level example, but at that point in time, people can ask that question, all the way to, hey, you just got this scheme from the government, right? Did you understand the benefits? Did somebody ask you for money, right? Did you have to pay a bribe? Essentially, could be asked in their own language. The bot is initiating the conversation and asking, so the user doesn't have to have that level of articulation. Based on the feedback on what they're saying, that data is recorded, captured, stored, and then you can use AI, analyze it, and act on that feedback. The problem of hallucinations doesn't appear because the bot is not really answering questions or giving information or giving advice. It's actually collecting, in some sense, experiences and data and qualitative measures of a service that have hitherto been impossible to capture. The reason why NPS, Net Promoter Score, or how much would you recommend us to a friend from a scale of 1 to 10. The reason why we used to capture feedback in that format is because anything higher fidelity than that would not be actionable. If I actually ask everybody to write an essay saying, write everything about your service, and let's say even people obliged and gave us those essays, whose job would it be to actually sit and read all of that and then action it? And hence we reduced our feedback systems to, star ratings. You go to a restaurant, your experience was multidimensional, right? The food was great, but the waiters were rude. Um, you know, uh, Loved everything about it, but the music was too loud, right? So a 4-star restaurant for you may not be a 4-star restaurant for me, especially if I have sensitive hearing, etc. So we used to reduce all of these things down to a simple numerical fact, etc. Because the way we couldn't handle the richness of true human feedback, right? So I think that can change now with AI. Ki Baat can become sort of a paradigm for people to sort of listen at scale, and then based on that listening, do action at scale. We did this, the sort of, I guess I'm being too theoretical, so let me give an actual example. At the 7th May event, we did we showed this thing that we had done in a hospital with about 100 people. So the government has a scheme, NHA, the National Health Authority, has a scheme called Scan and Share. Now, Scan and Share is a simple idea. The easiest way for me to explain it would be Digi-Yatra for a hospital. So if at the airport with Digi-Yatra, you don't have to, take out any physical paper, do any work, you just have it scanned and ready. You just walk up to a scanner and it scans your face and you walk in. With Scan and Share is something similar. Every time you go to a public hospital, even if you're going to an OPD, there might be a 2-3 hour line, because every patient is supposed to come in, give their sort of records, show their insurance documents, get a slip, then go stand in the OPD line, then go visit a doctor. So that first registration where they capture your name, capture your history, capture your basic details, the administration or registration part of a hospital, the things that you do before you even get to a doctor. Just there you could lose 2-3 hours on a queue depending on time of day, etc. So NHA had a simple idea using these apps and your health records. Just scan a QR and start doing that online, and then you have a token number even before you go to the line, right? This feature is launched, heavily publicized, and then just like Digi-Yatra, there's lots of people on the ground encouraging you to use that system, right, rather than this. Now, this leads to problems, right? Like one is, if it's somebody's jobs to take you to that line, then they will aggressively and coercively almost take you to that line and say, no, don't do it like this, do it digitally. And that person, to do their job and do as many as they can for targets, might forego some basic simple things like explaining to you what the system is, explaining to you what happens to your data, right? Like being patient with you basically is hard for them because of the constraints of their job, and like they're also given probably a not very high salary to just take as many people as they can to that line. With a system like Ki Baat, right, we can let 1:1 conversation happen at the pace of the choosing of that customer, right? Where the customer asks, what is this? And they're like, listen, here's the system, here's the benefits, here's what happens, here's how you don't have to wait at line, etc. So we use this Ki Baat feedback system to actually test out for 100 Scan and Share patients how their experience has been. It's very interesting. Everybody who tried the system, after they tried, they're like, yeah, this is so much better than standing in line, but I didn't know what it was, and I didn't know that the benefits are going to be, till somebody came and explained it to me and forced me to kind of do it. Not forced me is the wrong way to put it, but till somebody like really guided me and encouraged me to do this, I didn't even know this existed or could use it, right? So we said, okay, if that's the problem, how about we put this feedback, this idea of 1:1 conversation to understand what the scheme is before that person even meets you, right? So we just say, scan this QR code and start talking, right? Don't scan this QR to go to Scan and Share. Now scan this QR and it will take you to a page where you can just start talking to the app. And through that, we'll guide you to do registration, etc., whatever. So we created a whole new workflow around this based on the feedback that we got. And we turned around the feedback in basically like 2-3 days, right? Like over 2-3 days, we collected the 100 interviews. And that data we analyzed like within hours, right? Because of ChatGPT and other tools again, that we were able to like just capture the feedback and spot the trends of the most commonly given sort of problems. So we were able to get to this idea that people actually like the system, they just don't know about it. And we implemented a small change in the flow where you scan the QR, immediately it starts talking to you. So you don't have to wait for a human to even meet you. You start talking and it sort of suggests, oh, you're here for this? Okay. Do you know about the scan and share system? And they say, no, this is what it is. It will save so many hours in line. Are you comfortable doing it? Do you have any questions about it? And they're like, yeah, okay. Whenever they say, yeah, sure, this sounds fine, this sounds useful, we encourage them to then from there only start the scan and share journey on their phones itself. So even though it's such an obvious insight, right? Even when I tell it to you, I feel a little embarrassed. Like, why would people not do this already? Why would you not start with something like that? It's precisely these things that get missed when you're in the builder mode. You are very focused on getting things done. Having a line to your audience can help you spot and fix a lot of these sort of simple things. So that's one use case we're very bullish on. Sorry, I think I've delved too deep into this, but just to sort of step back and try to be more broad, I think at People+ai, we're trying to not just solve, one point problem. We're trying to look at for each industry or larger problems that India has, what could be the most promising thing that is unique to our situation, that either helps our population in a large way or, is a problem that we'll care about, but many other countries or many other societies may not.
But just let's complete that use case example a bit more, because it's really interesting. It illustrates, and the analogy of Digiyatra for hospitals, I think is fantastic. So the initial onboarding happens how? When a person goes to a clinic, there's a QR code that says scan this, or you download an app from an app store?
So you're right that there's an app from an app store that one has to download to get into it. And those, there are signboards put in every language of QR codes of the apps, etc. And it's the app guys also who are coming and promoting this, right? Like the apps which do this are there, and they've also put their QR codes and stickers to say that download our app and you'll scan and share. There is one QR code which is of the hospital. So where the OPD line is, there are normal lines, and then there are two counters once again which are scan and share counters. It's done deliberately to show that there's a shorter line, right? So there's a shorter line. People ask, why is that line shorter? Why can't I go there? Like, you can go there if you download the app, right? So it's the same idea of creating a better service and showing people it's faster, it's better if you use it digitally. So you download the app. On the app, you enter, you log in with DigiLocker, you enter some of your details, you register as you would, right? All the things that you would do on paper, the form filling, you do it digitally. And then you scan that, and you say that I'm in this hospital for this problem. It sort of knows you're in this hospital because it's scanning a QR code of this hospital. So you're like, I'm here for this problem, and here are my details. I'm sharing my details with you in a consented format for this purpose only, etc. And then the hospital generates a token number for you, right? And they give you that token number. What ends up happening is that a lot of this, while you can generate the token number online, the verification of the token number and the standing in line and whatever might still be physical. So even though the token number is generated in the app or you submit through the app, sometimes you have to go physically and collect a token. So the line has gone from, what you do in the queue. Again, in Digiyatra, what used to happen at the gate was that every time you pass those checkpoint, they would basically ask you for first your proof of flight, that there's a boarding pass. They check the time on the date and time on the boarding pass, that it is actually within 6 hours of now, because they don't let you into the airport otherwise. They would check that it's the right terminal, that you're not entering the wrong terminal with this. They would check your name against the name of a photo ID that you're carrying. They would check the genuineness of the photo ID. They would then check the face on the photo ID with your face, right? So these were the checks that one was doing at the door, right? In a hospital, the number of checks you're doing are even more complex. You're doing the same ID check and photo check as always. You're checking the document and the registration form having the same details as the photo ID. But then you're also collecting a few important health data, right? Like blood group, this emergency contact, what if something goes wrong. insurance or payment details, right? What is the severity of the thing that you're submitting for, right? Are there any sort of disclaimers or something that the hospital needs to get you to sign so that it is protected against liability? There's a bunch of things that the hospital does in that registration, which makes it even more complex than Digiyatra, which is why, even though it's just registration, it's not very complex. If each form takes 2, 3, 4 minutes to process at peak hour, when hundreds of people come in together, this can result in an hours-long queue, right? So this is what is being replaced, and how it's replaced is that all the details that the person filling the form would have asked them to do now happen on the app. So when you show up, they're just simply checking that you are the app, and the detail in the registration is you and nobody else. So there's reduced the complexity of what gets checked at the counter to a lot less.
I know it's more like a pilot right now, but which hospitals?
And the scan and share system is actually live in a lot of places. You will forgive me I hope, for not having the latest numbers, but I think it's in the lakhs, if not tens of lakhs a day already.
Okay. Yeah. Number of people using it.
Yeah. But remember, again, the idea is a very cool idea that we should do scan and share. We should have this. And it exists. And so the one that we did this pilot, our pilot is the generative AI feedback on why more people are not using scan and share, right? Even though it's lakhs a day, why is it not crores a day? So our Ki Baat intervention was to get feedback from the people as to what is working, what is not working. That we did in this Kashiram hospital in Kanpur. I have a video from that if you'd like to see it.
Sure.
This was, we just sort of asked a few people if they'd be happy to do it and how they'd do it, etc. We got that feedback, and then we got some of them we got on camera as well. And from that, we learned this thing that I was telling you, that there was hesitation essentially, right, for people to do something new. That hesitation once overcome, they understood the benefits. So we were wondering that what do we need to change for that hesitation to go away? And very naturally the answer, because of AI, etc., maybe being top of mind for us, was, hey, instead of them talking to that person in a blue shirt or whatever who's guiding them there, what if they were to talk with something on their own phones? Would that help? And we tried that also, because with AI these things are so easy to make. We tried that as well, and we found some promising results. But what we are now going back, and we're working on this as a project inside People+ai, is how do you reimagine this flow entirely with generative AI, right? Where from the start, instead of an app, it's just a conversation. It's like, hey, what's wrong with you? How can we help? Right? Okay, so you should go to a hospital. When you go to the hospital, there's going to be a line, right? Like, can we help you speed up the process of doing the line, etc.? And sort of maybe even manage the journey end to end after that, right? Like if somebody gives you a prescription and you have to follow it for a few days, right? Just checking in after 2 days, has the pain subsided? Is everything okay now, etc. So we're now trying to imagine that whole journey as a trusted assistant with you on your healthcare journey. And will that increase not just throughput, which is what we were doing earlier, but can that also increase other problems that the country faces in health, which is number one, late diagnosis. Some of these diseases, if you just were to catch a little earlier, right, it would have a much better impact on everybody. Second, follow-ups, right? People tend to take medicines till the immediate symptoms go away, but we know this is leading to drug-resistant strains of TB, etc. So we're just now trying to start and so do those journey like this. In the meanwhile, in healthcare, again, one more use case that just yesterday or day before we posted about on our social media is that, on the other hand, for doctors, right, especially in research hospitals sort of the Tatal Memorial Cancer Hospital, right, the doctors should not just be dealing with the patients in the cases, which is their important and urgent problem, but they also need to record what's been happening in every case. So that we create a collection of knowledge about cancers, of what works, what treatment doesn't work, so that we can improve our ability to treat patients, at scale. This makes a doctor's life very hard, because they not only have to do what they do with the medicines and all of that, they also have to simultaneously be making notes, filing cases, putting it all away, etc. Right? So there's a audio transcription sort of company launched out of India. It's very interesting because the founders initially wanted to take this to the US, and medical transcription services, they are already a thing. So they thought doing AI for that would be a better idea. Except there's already, like I said, a lot of competition, etc. And India is both underserved in terms of there aren't solutions here at the price points that can work for India. It's also underserved in that the needs and the complexities of India are different than those of the US. Their regulatory complex and compliance complexities are higher. In India, language, lots of sort of the noisy environments, other dynamic environments, other challenges are higher. So Anukriti actually started as a volunteer with People+ai and then sort of dived into this problem. And I'm very happy to announce that she sort of has live clients and she's doing this now. And basically letting doctors focus on the job of dealing with the patients, whereas all of this transcription and categorization and file creation and a bunch of other things is getting automated, right? What it's also creating is a large database of how people talk about disease in India, right? It's very interesting because somebody was explaining this to me, another startup, another founder, Rahul of Tap Health. He was saying that the simple idea of a headache, right? You and I will say, I have a headache, right? Some of us might be a little more descriptive and say, my head is throbbing, right? Somebody will say, it feels like someone's sort of banging a hammer on my head, right? This is evocative in English. When you go colloquial into every language, there might be phrases, right, that make no sense to you even in literal translation as a headache, right? कोई मेरे सर पे ट्रैक्टर चला रहा है, right, is the equivalent of that in say Punjabi, right? How do you know that means a headache? If you don't know that means a headache, you can't start treatments around, right, healthcare or whatever around that. One of the leading symptoms of diabetes is tingling sensations in the extremities, right? How do you describe that in Bhojpuri, right? Like, what's the right way to do it, right? Maybe they say something like "Junjuna ho raha hai" or kuch, right? Like they'll say something in a language in a way that nobody has bothered to collect and say this is a list of medical terms, right? Pet mein chudmui ho raha hai, right? Like these are things that one needs to understand to be able to deliver healthcare at that Kashiram hospital kind of, Nangaram hospital kind of scenarios where the patients come in and they have their own ways and experiences and sort of language about describing symptoms and pain and other things. So a lot of this needs to get built, and I guess it sort of dovetails into the part 2 of what we do, right? Like once we start doing these use cases, we start realizing that there is, in theory you can make an AI which is a healthcare assistant, etc. In practice, to do it, you need a list of all symptoms in all languages, in all dialects spoken by men, women, and children of all age groups, to be able to have enough representative data so that you know that inclusively, whenever anybody comes to a hospital and says this is what is wrong with me, they are fully understood, right? Without that data set, your ambitions of an AI healthcare assistant that gives healthcare for all won't get done, right? I know everybody wants to build this, right? There's unsexy work here to be done, which is just going out and collecting a lot of people describing headaches in every language, but not just headaches, but like every possible symptoms, right? Diarrhea in every possible language, right? All the drug names, right? Drug names and generally drugs and everything that people prescribe changes. Like it's paracetamol, but nobody calls it paracetamol. The doctor will say crocin le lo, dolo le lo, right? In some other jurisdiction, they'll say something else, right? So these are all things that, again, are painful efforts that need to exist for an area like healthcare to be solved by AI. So I think I'm getting a little all over the map, but then that's it.
Now I'm going to bring it back because I had in mind what I wanted.
Yeah.
One other thing, just for the audience to clarify. So the right now, the feedback bot is what you've built, and
Yeah.
some of the other things are startups and others who have
Yeah.
built these various things, right?
Yeah. Actually, so let me step back and talk about the use case vertical a little more before I get carried away. I think that one is very obvious problems of access that we can solve with AI today that we couldn't earlier. So we are working on ability for people to fill forms. That's our other big sort of horizontal use case that we see. So feedback is one. It's very horizontal use case. The ability to listen at scale, I would say, goes beyond feedback. Feedback is sort of one starting point of that use case. But once you can really incorporate the idea of listening at scale into your regular product cycle, right? How do I improve? How do I create a channel where every customer feels like they should give feedback, not just when it's a complaint, right? Most people tend to go leave a review when they're angry or unhappy because they want an outlet or a channel. But what if you could create a genuinely trustworthy experience with the customer where they feel like if they say something, it will be heard? It could be something as simple as, hey, next time when you call me, can you please not give me the whole spiel? Now I understand the service, just let's get straight to the point. And maybe a company listens, okay, for this customer, here is how we change the product, right? We remove this part from the thing. And the next time our bot interacts with them or whatever, we get straight to the point. And the customer would be delighted because their feedback at that level is heard and the product is changed, right? So far in a non-AI world, we had to be building products that were, sufficing the needs of many users on an average kind of basis. Any personalization or whatever that we had was within the context of a feed or say a Swiggy list of restaurants. The restaurants recommended to you might be different from the restaurants recommended to me, but the experience of ordering from that restaurant or whatever is all customized, is all standardized, right? It's the same thing, same flows for everybody. Which restaurant? AI was used. But we're reaching a stage where if you really incorporate this kind of feedback as a basic building block, the app as it looks to you may meaningfully be different from the app as it looks to me, right? So Ki Baat we see is a big horizontal use case because of what it enables, the AI product making it enables. That is why it is a fundamental tool to us, right? That's the number one. Similarly, another fundamental tool to us is the idea of filling forms digitally. Now, you say filling forms, but basically the idea is any transaction, a user is expected to give at least some details. Those details typically are name, date of birth, addresses, which I will come to in just a moment. We have something special there. Some amount of like financial, bank account, card number, payment, etc., whatever. And then a bunch of like demographic or other simple information, and then selecting yes, no, whatever, having a conversation like this medical form I was talking about, etc. So we are asking the question, how can we make filling up any form, physical, paper, digital, whatever, something that an AI does for you very, very easily, right? And it has context of you and the people around you for whom you fill those forms, so that doing this is no longer a chore. Because I think this is important because a lot of people in this country want access to services but don't know how to get it. And therefore they end up relying on agents. I don't mean AI agents, but real human agents. These agents may or may not have your best interest at heart. They may or may not be fiduciary to you. One common case of mis-selling in India is insurance mis-selling, where people are sold a financial product such as insurance under the guise of it being an investment. So the Digiform is another one of our horizontal use cases because we think that a lot of people, even if you make an AI agent to tell you about schemes, government schemes, or how this works or how that works, information about a thing is one step, right? Maybe they did not know that a government scheme exists in which if you're a working woman trying to do something, the government will give you a free bicycle. And this helps you in transport, right? There's a scheme like this and people don't know about it. That's one problem. But now if you found out about it, there's still a problem. How do you apply for it? And this is where you may end up having to meet an agent, right? A human agent, who will fill the form for you, knows where to apply, knows how to follow up, knows how to do. This human agent may not have your best interest at heart, right? They may tell you, yeah, you'll get this scheme or you'll get this. Actually, the worst example of this I saw was that sort of Renu, who works at my house, once came and told me, sir, government is giving me 4.5 lakh rupees. I said, why would the government give you 4.5? She's like, no. This one person, he came and he said, I just have to get one small brick and cement and whatever. And she said, can you give me 30,000 rupees? Because the government is about to give me 4.5 rupees, I'll give it back to you. I said, what do you mean? He said, no, this agent has come. And he said that if I just show one half under construction house, I can take a picture of that. Then he'll fill this form, he'll give it there, and government will give me 5 lakhs. He said he'll take 50,000. That 4.5 lakhs I can keep. I said, that doesn't sound right. Like, no, government will just give you 4.5 lakhs. What is it? So, do some digging, figure out scheme or whatever. There's some loan that the government gives if you're trying to construct a house. Loan. So, it's on her to pay back the entire 5 lakhs. But this agent is sitting there and saying, listen, you just give me this photo and this document. I will get you the money. I will keep 50,000. I will give you that 4.5 lakhs. You don't have to pay back the government. They're always, wipe off the loan eventually. Now, she's trusting this person, taking this advice. That man is making a quick buck. Liability will be on her. Right? Because if this goes awry and like the government says, you know what, no, screw it, we are going to collect from everybody owes us. Or at least some people they'll try to seize and collect or whatever. She'll be in trouble. That guy would be off, right? So knowing about a scheme is one thing. Knowing that it's a loan, not a grant, is another thing. But then actually applying for it is still a step. And that's a step where a lot of Indians falter. So we're trying to build this form filling thing so that, again, a lot of people can simply just sort of, if once they've understood, can apply for themselves. Right? So that's the other horizontal use case. But outside of that, we do a lot of vertical specific use cases in various areas. One of the things that I like to talk about because it's kind of out there is the one that we're doing for green building certification. So climate change sort of seems like a hard problem and seems like a problem that may not be very AI, right? But it's an interesting report McKinsey did that by for India to get to net zero by 2070, one thing you have to realize is that the India of 2070 is not even 1/3 built yet. So all the roads, highways, homes, constructions, dams, whatever, everything that you see, right? Hopefully you're not building more dams, but everything that you see in India, if you think about it from a 2070 perspective, this is just 1/3 of all the infrastructure that we need. Our cities are only 1/3 built. Our highways are 1/3 built. Right? I mean, okay, some of them more, some of them less, but you get what my point is,
right.
Average. Especially homes, right? A lot more homes are going to be built.
Okay.
If this is not built sustainably, cement and steel are some of those core hard to abate sectors. We already know that there are ways in which you can build buildings better, such that they manage energy better, such that the operating lifetime cost of the building is a lot lower. We know that there are ways in which you can use less cement in construction while having the same strength. There are all these techniques that exist, but the average person building a house is not doing this in green or sustainable way, right? Or building an office is not doing this in a green or sustainable way. Sure, Infosys will go and get net zero ratings and do a campus in Mysore that is net zero. But your local shop here and the people who's just constructing a residential tower here to give on rent, they're just going to go to the builder and say, make a house cheap. What if you could democratize both the knowledge to do it, but also if somebody is actually making a green building, the government could give them, say, faster approvals, right? So in a very low cost, zero touch way. This is sort of in smart city planning, urban planning, is one of those policy making that was considered very clever. That if somebody is doing it in a green way, in a sustainable way, is meeting policy objectives, what if their application instead of taking 6 months, 8 months, just fast tracks to 1 month, 2 months, right? This is real money on the table for the builders, for the developers, because their capital is stuck in that. Now, how do you reduce that time from 6-8 months to 1-2 months? AI. And we're already building this multimodal AI. You know, our machine, our server that's here. We're actually running it on this, where we're scanning building plans, right? Looking at the Gruha scheme. The government has a Gruha green sort of certification scheme for building and housing, and actually checking off each item, saying, does it qualify? Does it meet the Gruha standards or not? What is the score of this thing on the Gruha standards? Where you get a low score, it gives you recommendations on what can be done, right? So in that way, if this AI were to exist, imagine if all the construction in this company, in the country, in the next 2/3 of the infrastructure that hasn't been built for 2070, what if that could be green and sustainable by default? If we could just impact an area the size of Gurgaon, right? They have this number, some 1 million tons of CO2 we can save just by impacting an area the size of Gurgaon and building that greenly. If you go for the whole country, it's a massive push. So verticalized use cases like this are the use cases we're going for. And also another one which is more horizontal, but is our address thing, right? We're doing this thing called Sthaan, which is basically the idea of, in India, there's no structured address, right? So it's about solving a structural problem. So Ki Baat, feedback, form filling, I guess generic tools, private and public sector, etc. Verticalized, like climate, we have healthcare, we have education, we have a bunch of them going on. But let's also talk about another interesting horizontal, but also like kind of verticalized. It's doing one thing well called Sthaan. Sthaan basically means place, like Rajasthan is like thing. So the idea is that India doesn't have structured addresses. Our cities, Bangalore maybe, have 7th cross, 8th main, etc., which also is random sometimes, like 7th cross ends and then suddenly it jumps again to first or whatever. The blocks may not be in order. And like I say, New York or something where it's like, okay, First Avenue, Second Avenue, Third Avenue, etc. Our cities are unstructured, unplanned. And as soon as you get out of the cities, things just get worse, right? Like there is absolutely no naming convention. It's spelled in 5 different ways. People usually give landmarks like, come to the hospital, come to the bridge, come here. And then they give names, right? Like this is Guptaji's house, or this is this person's house, or Dr. whatever's house. So in some sense, reaching the right address in India is as much about who you know, not just what you know and reading street signs, etc. Google Maps helps, right? Because it's a pin or whatever. You can get to some place, or any other sort of GPS location can help if you get to a certain place. But it's not the same, right? When you do an e-commerce transaction, you're not giving a pin. You're giving an address. You're giving an address because they also will sort, okay, all these parcels will go to a Hyderabad hub, and from Hyderabad hub, they'll be distributed. Or these parcels will go for this pin code, will go to here, and then they're distributed. These will go by air, these will go by air. So you need some structure as well. Now, before generative AI, this seemed like a very, very hard problem, because addresses in India were of the sort that ये मंदिर के पीछे, bridge के ऊपर, like and go here, go there, come here and call me, right? This is the way that addresses were done. But with generative AI, we actually have probably the ability to understand vague instructions like this, structure them somewhat based on what we understand. And as people start doing more and more transactions over a certain address, build that intelligence that says, okay, this is what they actually mean. This is how you get there. This is the nearest pin code. This is the nearest district. Here is the main road. Here is how you do this, etc. And like really reinvent the idea of an address in a digital India at scale, right? It doesn't have to be the way the West has done it, which is there is line 1, which is the apartment number, whatever, line 2, which is the street and block number, and line 3, which is the city or like suburb and whatever. That structuring we've been trying to do for many years, like decades, and failing. But with Gen AI, we can come up with our own idea for what an address is and how to give that structure, even in an unstructured country like ours. And if we do it right, this is a problem that affects 4 billion people in the world, not just India. And I think we can do it right, because, see, in India, even though you don't know people's addresses, and that's a hard problem, we've given everybody a bank account. And through UPI, with a simple UPI mobile number and this mask, we can actually I can send you money. I may not be able to send you like a parcel. Like if I have to send you a box of sweets, it may or may not reach your house. But if I have to give you money, like a gift card, I can send that to you easily with a UPI. So how do we make addresses, physical addresses also at that level of fidelity, where a complex thing like your bank account number, IFSC code, all that complexity was masked behind this handle. So that is what we're trying to do. Sthaan handle, and which masks the complexity, and generative AI to actually make sense of that complexity and translate it into a reachable address for everybody. So this is sort of another broad sort of India specific use case, right? Solving a very India problem. I think if this gets unlocked, it is a force multiplier for e-commerce, force multiplier for credit, right? Because ultimately banks want to know where you stay before they give you money, right? So if we can make that, give them that assurance and intelligence that this works, this is where this person stays and transacts, I think we solve a lot of problems for the country.
So one quick 2-3 minutes on currently how it's being built. You're currently experimenting with in-house, or is there a startup which is building it?
Yeah, everything we do is collaboration. The way that this works is that we put out papers in Sthaan. There's a lot of papers out there. Digiform, there's actually demos out there, and Ki Baat, there are demos out there. Let me just sort of quickly cover each of these, a different way of doing it. With Ki Baat, we put out the idea there and reached out to a bunch of startups who are in that voice-to-voice AI, conversational AI space. 4 or 5 of them chose to partner with us, and we built demos with each of them and for their clients, and we also have some clients coming in. What we're doing there is that we are announcing the accelerator, putting it out there, and every time somebody reaches out or says, I would like to build this use case, we kind of just channel them to one of the startups, or like all of the startups if possible, and they choose whom they want to work with. One of the partners in the startups that we picked was Sarvam, and Sarvam has actually built a entire product around this voice-to-voice Ki Baat idea, which is what they unveiled on 7th May at our event. So, Ki Baat as such is a very simple idea. Honestly, there's not much right now we are doing in terms of an underlying platform or base or whatever. After we had those conversations and after we had a few Ki Baat demos, now we're very sure that there is a sort of safety protocol, a trust protocol, which underlies all these calls that now we are taking on and building. That is still under the works, but again, the way we'll build it will be much like we're building Sthaan, which is we've put out a paper on the problem statement. We've asked for volunteers to join. The volunteers meet every week and basically, assign tasks amongst themselves, make progress, come back, publish it out there. More volunteers also join, sometimes some leave. And we continue to improve what the core product or offering of Sthaan should be. But we also do workshops, which we've done 2 of so far, where we call industry players to sit down and deliberate, right? And if this existed, how would you use it? If this existed, how useful would it be to you? So we have, soft opt-ins from a lot of the logistics companies in this country saying that if this works, it is a game changer for us. So we would love to do it. So it's that co-creation of that DPI in the digital public infrastructure. That is a playbook that we've done before. So we know how to do it. What's interesting in Sthaan also is that ONDC, of course, DPI itself is very eager and keen to have it because their mission also dovetails with this very nicely, right? They're trying to bring e-commerce to the last mile. So for that, you have to first be able to reach the last mile, right? So this is important to them as well. So I think the way we're doing it in each project is slightly different, but the spirit of it is that, as is our core value given on our website, we build for the public in public. So anybody who wants to get involved can get involved, and you can observe the rhythm of how these things are done, which is, there is a small team which is leading this, which is actively working on it. And the team frequently checkpoints with the public, right? Very, very frequently, I would say, because honestly, a lot of people working on this problem are not experts in logistics or experts in addresses. They're just very, very interested nation builders. And I encourage any of your readers are also interested in something like this to come volunteer at People+ai/volunteer, right? And you can get on a call with us and from there start your journey. So this is how most things are built. Digiform, again, there is a mixture of startups and individuals. I think the problem is large enough that it's going to take, every size, shape, and imagination. There's no one answer for the country. Some people might be very good at doing it voice only. Some will do a mixture of voice and UI, but make it easy to fill a form. Some might do completely multimodal, right? Like fill up a form just by pointing a camera to things, right? Like they'll be like, don't tell me your name, show me your form. I'll understand the form, and then I'll be like, okay, why don't you show me your Aadhaar card or show me your whatever and show me your PAN card, and from that I will extract certain features locally on your phone and then use that to fill up the form, right? And I give you, say, a printable PDF that you can go print, and then now you have a paper form which is filled. So different solutions, different pathways. So there we're kind of just hosting a weekly show and tell, right? So everybody gets together, some startups, some of our volunteers, because this is something that even an individual can hack together. So some individuals are also coming together, and they're all demoing ideas and bouncing ideas of each other on what could be a great way to fill forms. And it's really, really heartening to see, because somebody has made something and they just want to show off and want to show to somebody else what they've done, and that triggers a thought in somebody's mind, and they come and they improve upon it, right? So this shows like the vertical 3 in action, right? When you create a space for collaboration, sort of magic happens. So each of these projects is progressing very differently. My job really is to get out of the way, right? Once there's enough energy in the room and enough people there who are wanting to do this, I think you should just let it be, right? Like people will figure something out. The best I can keep doing is giving them a actual connection to an actual use case. Like if something I see is good enough for, say, large scale deployment in some rural healthcare context or government welfare scheme context, I just try to make the right connections so that this idea can then be applied to that problem, and then that sort of invigorates the team again to go out and do more and do better, right? So that's how it works. It's really just people who take pride and joy in seeing their creations come alive, seeing it being used in a